Signs and symptoms of cardiovascular disease presented by Camille Diet in collaboration with Aruka SDHH. Heart and blood vessel disease, also called heart disease, includes numerous problems, many of which are related to a process called arteriosclerosis. Arteriosclerosis is a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot is formed, it can block the blood flow, causing heart attack or stroke. Types of heart disease. In order for us to look at the signs and symptoms of heart disease, we have to at least have a definition of the certain types, the most common types of heart disease. We start with heart attack. A heart attack occurs when the blood flow to a part of the heart is blocked by a blood clot. If this clot cuts off the blood flow completely, the part of the heart muscle supplied by the artery begins to die. Stroke. An ischemic stroke, the most common type of stroke, occurs when a blood vessel that feeds the brain gets blocked, usually from a blood clot. When the blood supply to a part of the brain is cut off, some brain cells will begin to die. This can result in the loss of function controlled by that part of the brain, such as walking or talking. Heart failure. Heart failure, sometimes called congestive heart failure, means the heart isn't pumping blood as well as it should. Heart failure does not mean that the heart stops beating. That's a common misperception. Instead, the heart keeps working, but the body's need for blood and oxygen isn't being met. Arrhythmia. Arrhythmia refers to an abnormal heart rhythm. There are various types of arrhythmias. The heart can beat slow, too fast, or irregular. Bradycardia, or a heart rate that's too slow, is when the heart rate is less than 60 beats per minute. Tachycardia, or a heart rate that is too fast, refers to a heart rate that is more than 100 beats per minute. An arrhythmia can affect how well your heart works. With an irregular heartbeat, your heart may not be able to pump enough blood to meet your body's needs. Heart valve problems. When heart valve doesn't open enough to allow the blood to flow through as it should, a condition called stenosis results. When the heart valve doesn't close properly and thus allow blood to leak through, it's called regurgitation. If the valve leaflets bulge or prolapse back into the upper chamber, its condition is called prolapse. Now we'll talk about the signs and symptoms of heart attack. Uncomfortable pressure, squeezing, fullness or pain in the center of the chest. Pain or discomfort in both arms, the back, neck, jaw, or stomach. Shortness of breath with or without discomfort, chest discomfort. Cold sweats, nausea, or lightheadedness. Signs and symptoms of a stroke. We use the letters in FAST to identify these. F, face dropping. A, arm weakness. S, speech difficulty. And T, time to call 811. Signs and symptoms of heart failure. You may experience a dry cough, increasing in frequency, worsening shortness of breath even while resting, increased swelling in legs, feet, and ankles, sudden weight gain of more than 2 to 3 pounds within 24 to 48 hours, discomfort or swelling in the abdomen, trouble sleeping, unable to lie flat, new or worsening dizziness, confusion, sadness, or depression. Signs and symptoms of arrhythmia: fatigue or weakness, dizziness or lightheadedness, fainting or near fainting spells, rapid heartbeat or pounding in the chest, shortness of breath and anxiety, chest pain or pressure. In extreme cases, collapse and sudden cardiac arrest may occur. Signs and symptoms of heart valve disease: chest pain, lightheadedness, shortness of breath, syncope. We have come to the end of the signs and symptoms of heart disease. To conclude, although some of the various signs and symptoms of cardiovascular disease may be similar to various conditions, it is not to be ignored. Knowing what are the telltale signs can be a matter of life or death. It is critical for an individual to seek out medical intervention to prevent these silent killers. This is my reference. I pray that you have a blessed day, and I thank you for listening.